Do you know you are at the verge of getting diabetic or not? So, if you want to know, you should watch this video. In this video, we will have three parts. First, types of diabetes, then symptoms of diabetes and complications in diabetes. So, let's delve into it. Here we will talk about diabetes mellitus. It is a chronic metabolic disorder in which blood glucose levels rise because of shortage of a hormone named insulin. Now let's go for first point. Types of diabetes. First is type 1 diabetes, which is an autoimmune disorder where immune system mistakenly attacks insulin producing beta cells and you need to take insulin daily to survive. It often occurs in childhood or adolescence. Second is type 2 diabetes. It is more common. Here, body becomes resistant to insulin and low production of insulin is not enough to overcome this resistance. It often develops in many years and is associated with lifestyle factors like being overweight or obese. In this, genetics also play important role. Third is gestational diabetes. It develops in pregnant females. It happens when body can't fulfill body's increased demands of insulin. Usually gestational diabetes goes away after baby is born, but increases the mother's risk of developing type 2 diabetes later and baby is at higher risk of certain health problems. Now, the last one is prediabetes. This is a condition where blood glucose levels are higher than normal, but not yet high enough to get diagnosed as type 2 diabetes. Many people with prediabetes go on to develop type 2 diabetes, but lifestyle changes can often prevent or delay this progression. So these are the main types of diabetes, but there are other types also like monogenic diabetes caused by a single gene mutation and some related to other conditions or drug use. Now let's know some symptoms which if you have or your known person have then they should go for diagnosis to doctor. Symptoms can vary depending on the type of diabetes and how high your blood sugar is. Some people having type 2 diabetes or gestational diabetes may not have noticeable symptoms initially. However, common symptoms are increased thirst, frequent urination, especially at night, increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing sores, frequent infections such as skin infection, urinary tract infection, etc., and numbness or tingling in the hands or feet, often in type 2 diabetes. Now, we will discuss complications of diabetes. Over time, increased glucose levels can cause different health problems, which include increased risk of heart attack, stroke, and narrowing of blood vessels. Can cause numbness, tingling, pain, and weakness, especially in the feet and hands. Can lead to kidney failure and the need for dialysis or kidney transplant. Can cause vision problems and even blindness. Nerve damage and poor blood flow can lead to foot ulcers, infections, and potentially amputation. Increased risk of Alzheimer's disease in people with type 2 diabetes. As we have come so far, so if you want to learn management of diabetes and common tests of diabetes, you can follow us on our channel Life Science.